Welcome to the Explainer. Okay, we're diving straight in today. We are taking a fascinating journey through antepartum health. We're going to take those dense, clinical prenatal guidelines, the exact protocols used by interprofessional teams of doctors, nurses, and midwives, and transform them into a really empowering narrative of complete maternal care. We'll look at everything from early medical protocols to the profound ethical responsibilities that guide every single prenatal visit. Let's get started.
Take a look at this powerful quote from the World Health Organization. It absolutely sets the stage for our entire discussion. It reminds us that prenatal care isn't just about, medical compliance or ticking off some massive checklist of tests. No way. It is a highly proactive strategy. By creating a vibrant, positive, and supportive pregnancy experience, healthcare professionals are literally laying the foundations for a lifetime of healthy motherhood. It's really about empowering families right from day one. So, here is our roadmap for today's explainer. 1. Establishing a health baseline. 2. Nutrition and lifestyle management. 3. Navigating high-risk complications. 4. Professional ethics and autonomy. And 5. Overcoming barriers to care.
All right, Pillar 1, establishing a health baseline.
Think of this initial phase exactly like laying the foundation of a house. Before you can build upward, you absolutely have to know what kind of ground you're standing on, right? So during that very first prenatal visit, providers run a standard battery of lab tests. And this isn't random. It's a highly targeted architectural blueprint for the rest of the pregnancy. They're checking a complete blood count to spot things like early-stage anemia, which is actually linked to preterm delivery. They establish the mother's blood type to prevent Rh incompatibility, and they screen for infections like HIV, syphilis, and hepatitis B. Catching those early means treatments can start immediately to protect both the mom and the developing baby.
But once that lab foundation is set, clinicians are faced with a surprisingly complex question. When is the true due date? Historically, you'd calculate this using the patient's last menstrual period. But let's be real, menstrual histories can be highly irregular and super unreliable. So how do doctors actually figure out this crucial timeline?
Well, here's the answer. The absolute gold standard for establishing the true due date is a first trimester ultrasound measuring the crown rump length, or CRL. Basically, it's a measurement from the baby's head down to their bottom, and it is incredibly accurate when it's taken before 14 weeks of gestation. Getting this timeline right is absolutely vital. Why? Because practically every single medical decision, screening, and intervention for the next 9 months is totally dependent on knowing the exact gestational age of the fetus.
Moving right along to Pillar 2, Nutrition and Lifestyle Management.
340. I really want to highlight this number because it completely busts that old myth that pregnant women need to be eating for 2. According to the dietary guidelines, 340 is the exact number of extra daily calories a mother typically needs during her second trimester. That's like what, an extra snack? It bumps up to about 450 in the third trimester. So it's not about doubling your food intake at all. It's about a slight, highly nutritious increase to support energy deposition and fetal growth. And that ties in perfectly to healthy weight gain. The Institute of Medicine maps out very specific targets, and you'll see that safe weight gain ranges are entirely dependent on the mother's starting baseline, specifically her pre-pregnancy body mass index. For example, a mother who is underweight might be advised to gain anywhere from 28 to 40 pounds. But on the flip side, a mother categorized as obese is guided to gain significantly less, maybe 11 to 20 pounds. There is absolutely no one-size-fits-all approach when it comes to this.
To get even more precise, interprofessional teams, especially prenatal dietitians and nurses, use a strict mathematical formula to calculate a mother's exact energy needs. First, they assess her daily physical activity level. Next, they calculate her non-pregnant estimated energy requirement based on her age, height, and weight. And finally, they add in that trimester-specific energy deposition we just talked about. This level of personalized care is amazing because it ensures the mother gets exactly what she needs without risking the complications that come with excessive weight gain.
But beyond just calories, there are some absolute musts and critical hazards. Every pregnant woman needs 400 micrograms of folic acid daily to prevent neural tube defects, along with essential micronutrients like iron, calcium, vitamin D, and omega-3s. Conversely, food safety is a big deal. Mothers are strongly advised to avoid unpasteurized milk and soft cheeses. So yeah, unfortunately the brie has to wait to prevent listeria infections. They also need to steer clear of high-mercury fish like swordfish and shark, which can severely impact fetal brain development. Oh, and caffeine? That needs to be strictly limited to 200 milligrams a day to prevent risks like early pregnancy loss.
Okay, Pillar 3, Navigating High-Risk Complications.
while pregnancy is a beautiful, natural process, it is also a massive physiological stress test on the body. Clinicians have to be hypervigilant in identifying serious medical hurdles. Notice the critical difference between the two conditions here: gestational hypertension and preeclampsia. Both involve high blood pressure, specifically a reading over 140/90 after 20 weeks. But the real danger lies in the systemic symptoms. Gestational hypertension features that high blood pressure, but with absolutely no protein in the urine. Preeclampsia, on the other hand, is a much more dangerous progression. It presents with proteinuria and severe, unyielding headaches or blurred vision and spots, often described by patients as floaters. If a mom mentions she's seeing floaters, it changes the clinical approach entirely, because preeclampsia can affect circulation to the entire body, including the baby. Clinicians are also constantly monitoring the placental environment, looking out for conditions with, admittedly, very complex clinical jargon like polyhydramnios. Let's just demystify this right now. Poly means many or much, and hydramnios refers to the amniotic fluid. So this is simply an abnormal and excessive accumulation of fluid during pregnancy. Why does this matter? Well, fluid abnormalities are key indicators that the pregnancy requires high-risk surveillance and, a lot of times, the intervention of maternal fetal medicine specialists.
Because the risks of complications naturally rise as the pregnancy progresses, the frequency of medical surveillance dramatically ramps up. What starts as a comprehensive check-in during the first trimester and monthly visits between 14 and 28 weeks accelerates to bi-weekly visits up to 36 weeks, and then, after 36 weeks, the mother is seen every single week until delivery. It's a super tight net of surveillance specifically designed to catch those late-stage complications like preeclampsia or fluid abnormalities the second they arise.
Moving to Pillar 4, Professional Ethics and Autonomy. With all these medical protocols and surveillance guidelines, we really have to remember the humanistic side of care. Medical guidelines aren't just a rigid set of clinical rules. They're deeply bound by professional ethics. The absolute cornerstone of this is the principle of beneficence. This is the ethical obligation of all health professionals to act strictly in the best interest of the mother and the developing fetus. Every single time a nurse or doctor suggests a prenatal diagnostic test, like an ultrasound or genetic screening, they must carefully weigh the clinical benefits against any potential harms. They have to ensure that their recommendations truly serve the well-being of their patients.
But right alongside beneficence is the fact that the mother's autonomy is supreme. In reproductive healthcare, empowering the mother is the whole point. She is the sole decision-maker regarding her care, particularly when dealing with sensitive things like genetic test results. Furthermore, her privacy is fiercely protected. Nurses and physicians cannot share her medical information with third parties, even family members, without her explicit, informed consent. This ethical framework ensures she retains complete control over her own body and her own pregnancy journey.
And finally, Pillar 5, Overcoming Barriers to Care.
We've talked about ideal clinical protocols, nutrition, and ethics, but we have to connect this individual medical care to a pretty harsh reality. The best medical protocols in the world are utterly useless if systemic social barriers prevent a mother from actually getting to the clinic. These are known as social determinants of health. We're talking about really tough roadblocks, reduced access to prenatal facilities, relying on totally unpredictable public transportation, facing serious language and communication barriers, lacking childcare for other siblings during appointment times, or dealing with prohibitive medication costs. True high-quality antepartum care requires healthcare teams to actively identify and help dismantle these exact barriers for their patients.
Bringing our narrative full circle, we return to the World Health Organization. By implementing timely, evidence-based practices, antenatal care undoubtedly saves lives. But more than that, holistic antepartum care that combines meticulous medical screening with nutritional counseling, fierce ethical protection, and vital social support, is the ultimate tool for empowering families. It literally creates the foundations for healthy motherhood and improves generational health.
So, I want to leave you with a provocative thought to ponder today. We clearly know the science of what makes a healthy pregnancy. The protocols definitely exist, but how can we, as a society, better support maternal autonomy and tear down these persistent social determinants of health? What is our collective responsibility to ensure that every single mother, regardless of her background or zip code, has access to this absolutely vital care? Thank you so much for joining me on this explainer. Keep asking those big questions, and as always, keep learning.